Hey, this is Dr. George Moricz. Have you ever wondered if there's really something called the check engine light syndrome? Imagine this, you're driving down the street, you feel this ball in your throat, your chest tightens as you see a flashing check engine light. You know, this can be one of the most distressful things, especially if you're late, have to be on time, or are in the wrong place. Well, as a human being, we know that there have been many people in our lives who went to the doctor, they had a yearly physical, they were cleared of anything, and then in a short amount of time, we find out that they had a fatal event, maybe an arrhythmia, heart attack, stroke. But the point is this: what really is the meaning of a yearly exam, a yearly physical, all that blood work, if year after year you're being reassured that, look, there's nothing really wrong. All you have to do is treat the consequences of the problem of your body and never the cause. So at this point you're thinking, what is he talking about? Well, we all get the check engine light on a vehicle. In reality, it's an idiot light. It's telling you something that you wish you had known in advance. The good news is with modern vehicles and the ability to scan them is that a lot of times you'll find out in advance, so you won't be stranded on the road or have blown up your engine. So the reality is that, yes, we've gotten better with our technology. But now you're saying, well, what is the real reason in people? I mean, why does your mind suddenly not work the way it used to? Loss of your mood, your body's energy has declined, and then you're not able to have the stamina that you did years ago. So we start to look at the body not just as, hey, you're taking this synthetic medicine for this, but what's the real cause? Let's talk about blood vessels, because this is the thing that gets a lot of attention. You know, we do have statistics on people dying of cancer in the United States, but the real leader in all this is heart disease. So you get these little, what we call atherosclerotic plaques in your blood vessels. The vessels harden, and then at some point you have what's called stenosis. Things get clogged up. Think of it like a pipe, whether it's under your kitchen sink or in your house, is you can clog it up a lot and you may not notice much, but one day, especially if it's over half clogged, you notice that there's a leak or things stop flowing. There's an obstruction. Well, in a very simple way, and I caution that this is a very simple way of thinking about it, is that if a cardiologist is able to do a catheterization and look in your vessels, they can see where there's significant obstruction. Okay, so the idea is that we are seeing the progression of coronary vascular disease, and what happens is at one point there's stenosis, things get clogged up. And depending on where you are in the process and in which of your big vessels, because we're talking about big vessels, although smaller ones are also affected, at some point you may need some relief, a stent or something to open it up. And yes, there are some ways to actually reduce the accumulation of plaque, which I do talk about with clients who have what we call arterial aging. So you have a chronologic age, as old as you are according to your birth certificate, and then you have biologic aging. So you're going to find all kinds of testing, especially with DNA, what we call telomeres, is you can measure the length of your chromosomes. Then I can also see decline in your youthful chemical messengers in your body. But most of you are already not performing and feeling like you did years ago. You've already accumulated fat in the body. You've lost muscle. Your skin is not as thick and it droops more. And your blood vessels are already hardened, just like a garden hose that you would leave out in the winter. Well, what happens? It hardens. So even if I do a special scan, if I look at calcium scores, I do have a cardiologist do a catheterization, what we're still missing is that the vessels have already hardened. So for people out there who tell me, hey, Dr. Moricz, I take blood pressure medicine, well, the walls of the vessels are already hardening. So that lower number, which really dictates the top number, it may already be fixed. You already have hardening calcification of those vessels. If you're someone who says, well, I'm not diabetic, well, diabetes is not just a light switch. You start with what we call glucose intolerance. You can have some insulin resistance, prediabetes. These are all terms for a spectrum. Just like most people don't have an engine failure just out of the blue, something preceded it. And if you had a crystal ball that didn't look forward but looked back, a real diagnostic, you would also see that as well. So this idea that one day you're a diabetic and the previous day you were not is completely ridiculous. And the way that you handle sugar, especially the way that it deposits and damages nerves and blood vessels, really is the issue when it comes to heart disease. So let's not forget that. People come to me and say, okay, so I also take a cholesterol medicine. Well, it's true that not everyone who has a high cholesterol is going to get a heart attack, and a number of people with what look like normal cholesterols can do the same thing. The reality is that this is an accumulation over many years. In other words, most people, even if they eat lots of fruits and vegetables, they still have accumulation. And once again, it goes back to a little bit to what protects your blood vessels from thickening up on the inside walls, what we call the intimal thickness. Well, it starts with your youthful hormones, peptides, and lack of inflammation. So you have a spectrum of regulators in the body that keeps things youthful, and then there's the toxic stuff that we put in our bodies, the things that we do to ourselves, the junk, the crap that we toxify ourselves for, and then we go to the doctor and saying, hey, I need to be fixed. I've got this insurance card. You've got to fix me. So the reality is that we're already setting ourselves up for heart disease. Not only the things we do to ourselves, but the conditions that we ignore from everything I said. Higher blood pressure. We ignore early sugar imbalance and the accumulation of cholesterols that actually can gunk up the insides of the blood vessels because we had added inflammation on top of it. So a lot of people say to me, well, hey, Dr. Moricz, so what is all this talk about, 2/3 of Americans being overweight and or obese? Well, what people say, I say, well, I'm overweight. That's really it's actually a medical term. The fifth vital sign that's not being measured today in the United States is your body fat, okay? So let's think about this. You have blood pressure, pulse, temperature, and weight. But body fat. If you don't measure it, you can't tell someone that everything's okay. And for men and women, there's different criteria, but the point is that body fat is critical to your youth. When you have body fat, it's not just an excess of calories stored away. It's not just a storage depot, it's inflammatory. It creates those inflammatory cytokines that you heard about during COVID. But it's also the thing that drives up your blood pressure, increases risk of cancer, and a lot of degenerative disease. So where I would start with most people is check all their vital signs, including their body fat. Here's your problem. This isn't going to happen at your regular doctor's visit, which is why in some ways, if you're one of the fortunate people who are told, oh, your 4 vital signs are normal and you had some labs done, everything's okay, but you're really not until you know your 5th vital sign. And then for others of you, you already know that your body fat is elevated, whether you are categorized as overweight, obese, and then you have a lot of these components of metabolic syndrome. The sugar problems, you had some blood pressure, you have some cholesterol issues, you are a perfect storm for a heart attack. So if you wait for the check engine light, if you look to the black box syndrome, a plane crashes, they rush for the black box and they start pointing fingers. Well, this is not about pointing fingers. This is about recognizing the process started a lot earlier in your life. What I see in anti-aging rejuvenative medicine is that people have physical signs of aging in their late 20s and early 30s. There are hidden signs. It doesn't matter if you don't acknowledge it, but there are hidden signs on the inside of the body. So if you have any signs of physical signs of aging on the outside of the body, I can guarantee you have them on the inside. And for today's purpose, if we're talking about check engine light black box syndrome, blood vessels. Your blood vessels can get hardened, they can get clogged, and you can have issues with depriving your body of oxygen. And whether it turns into a heart attack or stroke down the road, the point is that is the reality of what's happening. Usually in anti-aging medicine, we can see things 10 to 15 years in advance because of this approach, okay? And this is not an approach you can expect in a quick 5-minute visit or a regular physical or I just had blood work and so forth. The other problem is very little of that will actually tackle the issue without the use of synthetic medicines. So other people have already reassured themselves, well, I just keep taking these medicines and, I take an aspirin or I take my statins or I take a high blood pressure medicine or I just take that diabetic medicine. This idea that any medication could help you is counterbalanced by the things that we do to ourselves. And if you are so lucky that you are doing all the right things, you're still not out of the water. Because time and time again, people come to me and they tell me I was just cleared, I had an exam, and then I show them things they hadn't seen. So then there's two reactions. There's defensiveness. Yeah, but they already told me. We all want to believe a better version of what's going inside our body. And then they realize, hey, you know what? This guy is trying to help me and show me things that I didn't see before. This is what anti-aging rejuvenative medicine is doing. And it's not for everybody. I think most people are just fine chugging along and they're just waiting for that check engine light black box syndrome, and that's okay. But for others of you, you're thinking, what if I too wanted to understand this more? Click the link below. Get on my daily, weekly thread by email and Facebook, and I'll show you a way that will help you feel and perform like you did years ago. See, the only difference between you and people who are already enjoying this bigger life is that they've already made the decision to participate in this, and you are just looking the chance for yours. This is Dr. George Moricz. Thank you.